Councilwoman Bustos.
Thank you, Madam Chair, and thank you, Mr. Secretary, for being here. We appreciate it. So I come from the state of Illinois, where we've actually had some cases of coronavirus. And I actually want to shift my line of questioning, not so much just around appropriations, even though we're here at our Labor H Subcommittee of Appropriations, but more about preparing communities. About 85% of the towns I represent are 5,000 people or fewer, 60% are 1,000 people or fewer, so a lot of small and rural areas. And with the expected increase in cases that we've learned about, what will you and your department do to help prepare our local health providers to be ready for this?
Yeah, and Congresswoman, first, thank you for your leadership on rural health, and really appreciate you coming over and meeting with me.
I appreciated you having me. It was very nice of you. Thank you.
Yeah. In terms of rural communities and rural hospitals and providers in the coronavirus situation, first, we don't know how broad any spread would be. We prepare for community outbreaks. Those could be really localized, and then taking mitigation efforts. Dr. Ann Schuchat, who's the top career official at CDC, yesterday at our press conference, she tried to clarify one of the misimpressions that people have had from our current active containment efforts. Because right now we're bringing people back from China or from Japan, repatriating them, and they may be positive. We're in active containment. We are using high-end health facilities like Ebola treatment centers as really isolation units for them, even though they don't require that level of medical care, because we're in an active containment. We don't have another place for them to be. So the impression, I think, is getting created that anybody who gets novel coronavirus not only goes to the hospital, but also goes to a very intensive type negative airflow facility, which our rural communities don't have.
Right.
In fact, what she said is most people who would get novel coronavirus are going to stay at home. They're going to treat it the way they would treat a severe flu or a cold, managing symptoms, and we will publish clear information when you should seek medical attention, when you might go to the hospital for the rarer instances where that would be required. So part of it is really managing that patient flow so we don't collapse our rural hospitals unnecessarily. So it's really important that we all work together to educate the public and providers about that.
So it's really no different in rural America than urban America. It's just educating the public on how best to treat this rather than head to the biggest hospital.
That's right. Don't race. It's not going to be racing to the emergency room, right? But also the state and local support in the SUP will, of course, be really important for our hospitals and local public health agencies.
Okay. All right. Thank you. Let me